Namaste. Why is it that men don't feel responsible if their wives don't conceive, or if their wives undergo with multiple failed IVFs, or if their wives undergo with multiple failed pregnancies or miscarriages, or if the child born is born with certain defects or genetical abnormalities? We have so many females walking in our clinics with a big file of multiple reports, multiple investigations done, and repeated investigations. They are undergoing these tests and treatments and multiple investigations done again and again. And if I ask for the semen analysis report of their husband, it is done somewhere for the last before 2-3 years ago. I mean, that's not even repeated, that's not even asked for, or that's not even considered as a very important investigation. So let's understand today, why is it that the sperm also plays a vital, a major role, or rather an equal role when it comes to conception, conceiving. And it's not only conceiving, it's also when a healthy embryo is formed and the fertilization is successfully done, and after that the whole pregnancy process is fine, goes hassle free, and the child born is also born devoid of any abnormalities or any kind of genetical defects. So most of the times this is the most neglected part, unfortunately, and even men don't feel that they could be responsible towards this. They always feel that is a primary job of the female to conceive, and if all her reports are normal, still there could be some problem in the female, and that's why she is not able to conceive. Unfortunately, the semen analysis is not taken into care, is not considered as an equally important investigation, and it's not taken care of. So let's understand that what is it that we need to check in a semen analysis report. It's not only the count of the sperm, it's not only कि count अच्छा है तो you are done with your reports. The count is fine, it should be good, but apart from that, most important thing is also the liquefaction time, the motility, the vitality, the pH, the volume, the morphology. The morphology states the size and shape of the sperm. Like most of the times the sperm count is normal, the motility is fine, the vitality is fine, but the semen morphology is affected. We come across many females who come with the report, with a semen analysis report, which has only 1 or 2% of normal sperms, or 0% of normal sperms. It means that 98, 99 to 100% of sperms are abnormal. So the morphology basically states the size and shape of the sperm. The sperm basically has a head, neck, tail. It comes with a basic structure, and if there is any abnormality at the head or the neck or the tail or the body level, then it could not function properly the way it should function. It will not have a decent motility or a required motility, the vitality, and hence the process of fertilization and embryo formation may not be successful, or the embryo implantation will not be successful, or it may lead to further pregnancy loss or certain genetical defects later on in the child born, or also it may lead to multiple IVF or IUI failures. So always important, always understand that this is the most important investigative factor along with the female factors, which are commonly checked again and again, but this report is never ever checked. Females come with a very old paper, that investigation print, and it's so old, it's almost 3-4 years old report, which is already abnormal, which is already not in a good shape, but still it's not even considered. And the female is the one who goes to clinics, visits the doctors, and she thinks that I'm the one who is responsible for not conceiving, or for my multiple pregnancy losses, or for my multiple IVF failures, and she is the one who is burdened with all the treatments and all the investigations. So sperm is very, very important. Semen analysis has to be in a good shape and has to be treated if it's not in a good shape. Now let's understand what are the causes of semen abnormalities. Why is it that just like females, have certain disorders or certain abnormalities, it could be hormonal issues or PCOD or anything related to females, why do we commonly see multiple sperm defects in men these days? So let's understand the causative factors. So when it comes to men and when it comes to semen abnormalities, the most important factor is the genetic factors or the lifestyle and dietary imbalances. Addictions, drinking, smoking regularly or even occasionally can have a direct impact on the sperm count or the semen motility or the morphology, and also at the DNA genetic level also there could be certain abnormalities seen, or certain medications if you're consuming for a longer duration, that could also lead to certain sperm defects. Apart from that, past or present infections, trauma to the testicles, undescended testicles, irregular work shifts, mostly the night shift can have a major effect on the overall sperm quality or the quantity. Then the chromosomal defects, then the sperm DNA fragmentation. So these are multiple causative factors that could lead to an imbalance in the report, in the investigation when it comes to semen analysis. So let's understand how to correct and how can you play a major role towards helping your wife towards conception, helping your wife towards not having multiple miscarriages or having a healthy child born later on, devoid of any abnormalities or any kind of genetical deformities. So most importantly, Ayurveda says that the bija, the seed basically, is very important when it comes to conception. So men and women, the Purush bij and Stri bij, that the sperm and ovum respectively, both are equally responsible when it comes to conception, or if there is a history of miscarriages or certain abnormalities in the child born later on. So you both carry equal responsibility when it comes to conception and further certain complications if arise later on. So bija, the seed, is very very important. It should be devoid of any abnormalities. Genetically also it should be in its utmost state, and it should not be carrying any kind of genetical defects or as well. So it has to be considered, taken care and treated accordingly, and then you can get great results and you can expect pregnancy and expect a full-term pregnancy and have a good a healthy child born or healthy child birth later on. So Ayurveda recommends various treatments and panchakarmas when it comes to male infertility. So with a detailed consultation, most importantly the Nadi Pariksha, the constitution analysis and the condition of the patient or the person, we have to think about the various panchakarmas that can be designed and recommended to that particular individual. So panchakarmas like Vaman, Virechan, Basti, Uttar Basti, Nasyam, Shirodhara are planned in a particular individual according to his constitution and the current health state and condition. So these various panchakarmas, they help to correct at the dosha dhatu level, they help to correct at the genetical level, at the DNA level. There are certain corrections seen, and hence the conception happens, and post conception the chances of miscarriages are lessened and the child born can be healthy and will not carry any kind of genetical or chromosomal defects further. So please understand that men are equally responsible when it comes to conception. Please accept this fact and do not hesitate to walk in with your wife to the fertility clinics, and always keep your semen analysis report updated and get it tested and get it treated on time, so that your wife will not have to suffer. She will not have to undergo with various multiple treatments and medications and hormonal injections for no reason. You have to get yourself firstly tested, accept the fact that there could be certain abnormality and that those can be treated as well. It's not that it is untreatable and it's not a big thing. It can definitely be treated. So please go ahead and accompany your wives to the fertility clinics and get yourselves treated as well.